When we are dealing with infertile couples, a very difficult problem is one of azoospermia. Azoospermia means that there is no sperm in the gentleman's semen. When the semen sample is normal, we can offer a wide variety of treatments to the couple, from ovulation induction, from artificial insemination to IVF. When the sperm count is low, what we call oligozoospermia, then we can offer this couple the ICSI treatment. But when there is no sperm at all, what do? We need sperm and we need an egg to make an embryo. So it's important that we are able to retrieve sperm from these gentlemen. In some men, the sperm production is going on normally, but the outflow tract, the tube that brings the sperm from the testis to the outside, is blocked. This tube is highly convoluted and we call it the epididymis, and it is several meters long. So if this is blocked, either from birth, which we call congenital, or as a result of infections, either sexually acquired or tuberculosis, or as a result of surgery. So if a gentleman has been married before and has had the desired number of children, doesn't want any more children, quite often he would go for a procedure called the vasectomy, where the vas deferens, the tube that brings the sperm to the outside, is tied off. If this gentleman then marries again and is desirous of having more children with his new wife, then he has no sperm in his semen. So in all these situations, there is sperm production going on normally in the testis, but it's not able to come outside. And the semen, when we examine it, shows no sperm at all. In 1993, when I was quite new in Dubai, I came across an Iranian gentleman with this problem. What was then available for these gentlemen to retrieve sperm was an extensive surgical exploration of the scrotum, whereby the testis was brought outside, the epididymis, or the tube which was conveying the sperm from the testis to the outside, was displayed, incised, and the sperm were aspirated from the epididymis. This was a procedure which was done under microsurgery, which meant that the entire operative field was displayed under a high-powered microscope. Only then we could see the dilated epididymis. This procedure at that time wasn't available in Dubai, and I was wondering what to do for this gentleman. I then thought, if I can feel the epididymis clinically with my fingers, why can't I put a very fine needle through the skin into the epididymis and suck out any fluid that is present in the epididymis? So we did this for this patient, and lo and behold, we found sperm in the fluid that we aspirated. We call this procedure the Pesa, or percutaneous epididymal sperm aspiration. The sperm that we retrieve from the epididymis are quite weak. Some of them haven't undergone the full maturation process, and some of them have been lying around in the epididymis for a long time. And we found that trying the conventional IVF treatment using this sperm wasn't very successful. We didn't get fertilization adequately from these sperms. By that time, ICSI had already been introduced, and when we used this sperm from the epididymis to do the ICSI treatment on the couple, we got wonderful fertilization, and in fact the first baby born from this procedure was to an Emirati couple from Sharjah in 1994. I published this information in the Human Reproduction, which is one of the leading fertility journals. The beauty of this procedure is that this procedure can be performed so easily, without anesthesia, without any skin cuts. The patient is fully awake because we are doing the procedure under local anesthesia, and walks off the table 10 minutes after we have completed the procedure. We're able to retrieve a good number of sperms, so we can use some of the sperms to do the ICSI procedure, and the remaining sperm can be frozen for future use. I'm very pleased that this procedure of Pesa has been adopted the world over, and almost all fertility surgeons are using this procedure in cases where there is a blockage in the outflow tract to retrieve sperm for the ICSI technique. Doesn't require very much training, can be performed by any fertility specialist, and it is so patient friendly. Once we had success from the Pesa technique, whereby we were retrieving sperm from the epididymis, we turned our mind to men who had low sperm production in the testis. You need to be producing roughly about 5 million sperms for the sperm to be able to find its way out into the epididymis and from there out into the exterior. If the gentleman is producing less sperms than this sperm will just stay in the testis, it won't come outside. And we thought, why shouldn't we be able to retrieve this sperm using a minimally invasive procedure? Surgeons in the United States had developed a technique whereby they opened up the entire scrotum, took the testis outside, cut the testis open and looked for tubules within the testis where sperm production was happening. This procedure was an extensive procedure. It required microsurgical skills and once again wasn't available in our part of the world in the mid-1990s. And we thought if we've had success in retrieving sperm from the epididymis, we might be able to retrieve from the testis as well. And there we developed this procedure called Tesa, or testicular sperm aspiration. Once again, it's a simple technique. It doesn't require general anesthesia. We routinely perform this procedure under local anesthesia and a mild sedative. The gentleman is awake. We use a needle to enter the testis. By moving the needle around, we're able to sample multiple sites in the testis. We apply a suction force to this needle and suck out testicular tissue. This testicular tissue is usually sufficient for us to do two things. One, to send for histopathology, and secondly, to look for sperm in this tissue in the embryology laboratory. So what we would do then is, once we have retrieved this testicular tissue, we macerate it, and under a high-powered microscope, we look for sperms. Very often, we will find sperms that are alive, normal in shape, and moving very, very well. We are able to pick up these sperms and use them to do the ICSI procedure for the eggs that we have retrieved from the wife. We reported this procedure for the first time in the Lancet in 1996, and I'm delighted to say now that most people all around the world are using this technique to retrieve sperm from the testis. The beauty is the simplicity and the ease by which the patient is able to undergo the procedure with minimal discomfort. Routinely, the patient is able to walk off the table himself. He then normally sits in the recovery area for about an hour and goes home being completely pain-free and being able to perform all normal duties.